Like Dee Dee DePerson, thank you.
Thanks. I just had a quick question because we talked about, I think it was Dr. Enterman said, sea to shining sea. Does that include non-documented people? And interested in people's positions on covering non-documented people?
Let's see. Here's what we're going to have to do with that. I think you're going to have to step up here, yes.
I think we were thinking primarily of legal residents of the United States. I think with undocumented people, you have a very tough political problem. This is a democracy. In California, our governor proposed what I thought was a reasonable resolution of that, which is the undocumented would look to the public safety net system for their care, but we would not finance them with a kind of open-ended fee-for-service model. But you know, it's debatable. You look at some undocumented child who's seriously ill, and you can't help but feel horrible that the child isn't getting proper care. So I don't want to defend that, but just say realistically that's likely to be the resolution in our democracy.
I think that is likely to be the resolution in our democracy because it's the resolution right now. And I think if you look at what happened in Massachusetts, much of the money that was supporting the safety net in its role was diverted to cover everybody, saying, well, you won't need the safety net anymore. But in fact, Cambridge Health System, which is like Denver Health in Boston Medical Center, have almost gone broke because the money to support this effort went away. But the patients who still live here, who still get sick, still showed up and needed care. So I don't think we can ignore this question, although I do understand it's politically very difficult.
Question there. Yes, thank you.
Two quick comments. One, our healthcare system, to a large degree, is now publicly traded companies that sort of require some sort of return on investment, which is driving a lot of the cost and some of the practices. And I've always thought that it would make an interesting situation if you had investors become policyholders in the healthcare companies that they're investing in and sort of require them to decide if they're looking for that return on investment or if they're looking for the quality healthcare. And I wouldn't say that they're mutually exclusive, but I think that we are driven by certain investments which may sort of derail our consideration of more efficient, and it should be more efficient if you're truly trying to get an investment return. The other thing I might say is that it seems to me that the government has taken a bad rap, and it's constantly made an issue about people not wanting the government to make decisions about their health care and what they're going to receive and what they don't. And it seems to me that the government would not necessarily do any less of a job screening and determining what available coverage is compared to the private sector. If somehow the general population believes that the private sector would be less onerous in making decisions about what to receive versus the government. And I would just say that maybe the government needs to do a better PR job about overcoming this perception that they would be denying coverage or denying care any more so than what we see in the private sector. And I think that that's a consideration that most people struggle with, is that the government is perceived of being a more restrictive coverage, and I'm not so sure that that's true.
Thank you for that. Do you want to make a comment on that?
Well, I think he makes some very good points. I hold no brief for the publicly traded companies. I have friends who work for them. They're nice people. But I personally think it would be better if we had nonprofit systems like the ones that I talked about, which are able to take a longer-term view. On the other hand, as to government versus private sector, I had a life-changing experience when I went to work for John F. Kennedy and then Lyndon Johnson, and my job was to bring cost-effectiveness analysis to the Pentagon, a quixotic task for a young man. And while the president thought it was wonderful and even gave me a medal, when I got up to Capitol Hill, they called me public enemy number one. because they didn't care whether the thing worked or was cost effective or anything else. They would just want to be sure it was built in their district. So I came away with the insight that the ideal weapon system is built in 435 congressional districts. Right? And I think today, if you look at Medicare, alas, there is a huge amount of pork barrelization there. I mentioned the question of physician fees. There's also hospital payments, where members of Congress want to bring home better payments for their districts. There's also, a few months ago, there was an interesting article in the New York Times about, said, you know those walkers that you can buy at Walmart for $59? Guess what Medicare pays for them? They pay $110. And why is that? Well, it turns out some people proposed that we should have competition for supplying medical equipment. Well, there are a lot of companies that make medical equipment, and the last thing they want is competition. So they managed to buy or elicit, or whatever you want to say, leading members of both political parties in Congress to change the law to postpone the competition demonstration. So that's kind of the problem I have with I think the government has to create the framework, has to define the boundaries, has to subsidize people, create the rules, so forth. But I think the actual delivery would be better by competing non-governmental units.
Doug, have you, one more question? All right, good. Who's got the microphone? That's, you win.
This will be disappointing, but could someone on the panel discuss if there's been any research around if a comprehensive solution is not available, perhaps addressing the issue of medical bankruptcies from traumatic injury or traumatic illness?
Takers? Anyone?
I think it's shocking. I mean, it should be a
Matt,
source
want
of,
to come up to the mic?
it should be a source of shame in a wealthy, advanced society like the United States that medical costs are, I think, the biggest source of personal bankruptcy. It's outrageous. And that's one of the impetuses, in addition to all these other issues, that we have to fix this system. And I'm not sure what to say beyond that. And it's not beyond the mind of man to actually do that. So here's hoping, since this is the last question, here's hoping in the next 3 months we get our act together, all of us, and, you know, even if there's some differences at the margin, you know, there's got to be a way that people of goodwill can come together and say, we're going to do this now. It's going to be imperfect. Every major reform is imperfect, and it never ends. You come back and you fix it. But there's a chance if the stars are aligned to do this, and so I hope everyone will head to the barricades and make this happen.